A woman walks into Regmore Hospital in Inverness, Scotland. It's 2013. She's 65 years old. She needs surgery on her hand. Severe osteoarthritis. The joint has deteriorated completely. The operation is one of the most painful procedures in medicine. Patients describe it as excruciating, unbearable. They need strong painkillers for weeks afterward. The surgery goes well. The next morning, the nurses ask Jo Cameron how she's feeling. She smiles, says she's fine. They offer painkillers. She declines, says she doesn't need them. The nurses exchange glances. Something is wrong, very wrong, because Jo Cameron isn't just fine. She feels nothing, no pain, no discomfort, nothing at all, and she never has. Her entire life. This is the story of Jo Cameron, a woman who discovered at age 65 that she's superhuman, that she has a genetic mutation found in only 2 people on Earth. A mutation that eliminates pain, eliminates anxiety, eliminates fear. It sounds like a gift, like a superpower, like evolution's jackpot. But it's not. It's dangerous, because pain isn't the enemy. Pain is the alarm system, and Jo's alarm system has never worked. For 71 years, she's lived without it, and she never knew anything was wrong. Jo was born in 1946 in Scotland. From childhood, she was different, but nobody noticed. Not even Jo herself. She would fall, scrape her knees, not cry. Other children cried. Jo didn't. Her parents thought she was tough, brave, strong. They never suspected the truth, that she couldn't feel pain, that her nervous system was fundamentally different, that she was missing something essential. As a child, Jo frequently injured herself. Cuts, burns, bruises. She wouldn't notice until she saw blood or smelled burning flesh. One time, she was cooking. Her hand touched a hot pan. She didn't pull away, didn't react, just kept cooking until the smell hit her. Burning meat. She looked down. Her hand was blistered, severely burned. She stared at it, confused, not in pain, just confused. Why was her hand damaged? She hadn't felt anything wrong. Jo described her childhood as happy, normal. She played sports, broke her arm once, didn't realize until hours later. She noticed the arm looked odd, bent wrong, went to hospital. The doctors were baffled. The fracture was complete, significant. She should have been screaming, but she was calm, cheerful, chatting casually. They set the bone. She went home. No painkillers needed. The doctors chalked it up to high pain tolerance, to toughness. They never investigated further. Jo became a teacher, married, had children, lived a completely normal life. But certain things were different, things she didn't question. She never got anxious before exams, never felt stage fright, never panicked in dangerous situations. Once, she was in a serious car accident. The car spun, hit barriers. Other passengers screamed. Jo remained calm, curious, observing. No fear, no panic, no adrenaline rush, just calm observation. Her childbirth experiences were unusual. She had 2 children. Both deliveries were natural. She described them as quite pleasant. Not painful, not difficult, just pleasant. The midwives were confused. Most women describe childbirth as agonizing, traumatic, the worst pain imaginable. Jo found it interesting, slightly uncomfortable, but pleasant overall. She assumed other women were exaggerating, being dramatic. She never realized she was the unusual one. Throughout her life, Jo forgot things. Keys, words, names. She thought everyone did this. That memory lapses were normal. She was optimistic, always happy, never worried, never stressed. She scored 0 on anxiety scales. Literally 0. Psychologists had never seen that before. Everyone has some anxiety, some worry, some fear. Except Jo. She had none. None at all. At age 65, Jo needed hip surgery. Her hip joint had degenerated severely, bone on bone. Doctors said it must be agonizing. She should be in constant pain, unable to walk properly. But Jo felt nothing. She walked normally, functioned normally, felt fine. The surgery was major. Hip replacement. Very painful recovery. Jo recovered quickly, easily, without painkillers. The surgeon was puzzled, but busy. He didn't investigate. Then came the hand surgery. Age 66. Same hospital, different surgeon. This operation was notorious. Hand surgery with joint reconstruction. Patients needed strong opioids for weeks. Morphine during recovery. Jo needed nothing. The anesthetist checked her records. No painkillers ever prescribed. After any surgery, after any dental work, after any procedure, nothing, ever. He knew something was medically impossible was happening. Dr. Devjit Shrivastava was her anesthetist, a consultant in pain medicine. He recognized this wasn't normal toughness. This was pathological, a complete absence of pain sensation. He referred Joe to pain geneticists at University College London, to Dr. James Cox, an expert in pain genetics, someone who studied rare pain disorders, who had seen unusual cases, but never anything like Joe. The UCL team tested Joe extensively. They gave her pain tolerance tests, applied heat, applied pressure, applied ice. Joe felt temperature, felt touch, felt texture, but not pain. The signals weren't converting. Her brain received information, but processed it differently. Temperature registered, pressure registered, but pain didn't. The warning system was broken. The alarm was disconnected. They sequenced her genome, analyzed her DNA completely, looking for mutations, for anomalies, for explanations. What they found shocked them. Joe had 2 genetic mutations, working together, creating her unique condition. The first mutation was in a gene called FAAH, fatty acid amide hydrolase. This gene breaks down anandamide, a natural painkiller, a molecule named after the Sanskrit word for bliss. In normal people, FAAH breaks down anandamide quickly. Pain signals get through. But Joe's FAAH gene was mutated, damaged, not working properly. Her anandamide levels were elevated, constantly, naturally, like being on permanent low-dose painkillers. From birth, her body produced its own morphine, her own cannabis, her own bliss molecule, at high levels, all the time. But the FAAH mutation wasn't enough. Other people had it. They felt reduced pain, but not complete absence. Joe had something else, something unique, a second mutation, in a gene nobody had studied before, a gene thought to be junk DNA, non-functional, useless evolutionary remnant. But it wasn't junk. It was crucial. The UCL team discovered it, named it, called it FAAH-OUT. FAAH-OUT regulates FAAH. It's a volume control, a dimmer switch. In normal people, it keeps FAAH at the right level, pain sensitivity balanced. But in Joe, FAAH had a microdeletion, a piece of a gene missing. The volume control was broken, stuck at maximum. FAAH was turned down completely. Anandamide flooded her system. Pain signals were blocked, completely, permanently. Since birth, the researchers published their findings in 2019 in the British Journal of Anesthesia. The paper made international news. The woman who couldn't feel pain, the real-life superhero, the genetic lottery winner. Media called her lucky, blessed, fortunate. But the scientists knew better. They knew the dangers, the risks, the hidden costs. Joe's condition came with side effects. Beyond painlessness, her memory was affected. The elevated anandamide disrupted memory formation. She forgot conversations, forgot appointments, forgot details. Not severely, not dementia, just constant mild forgetfulness, like being slightly stoned, all the time. Since birth, she thought everyone was like this, that everyone forgot things constantly. She didn't realize she was impaired. She also healed unusually fast. Cuts closed quickly. Burns recovered rapidly. Scars were minimal. The researchers discovered why. Her mutation affected the WNT16 gene, a gene involved in bone regeneration. In tissue repair, her body healed faster than normal, significantly faster. This probably saved her life multiple times. Her injuries healed before becoming infected, before causing complications, before killing her. But the most dramatic effects were psychological. Joe had zero anxiety, zero fear, zero panic. This wasn't bravery. This was neurological. Her brain couldn't generate fear responses. In the car accident, when others screamed, her amygdala didn't activate, didn't sound alarms, didn't trigger survival responses. She was in mortal danger and felt curious, not afraid, curious. This could have killed her, should have killed her, but luck protected her. The researchers tested her with threatening stimuli, showed her horror movies, frightening images, dangerous scenarios. Her heart rate remained normal. Her stress hormone stayed low. Her brain showed no fear activation. She watched calmly, interested, not scared. The part of her brain that generates fear was silent, dormant, non-functional. She couldn't be frightened, couldn't panic, couldn't feel existential dread. This sounds appealing. Imagine life without fear, without anxiety, without worry. But fear is protective, essential. It keeps us alive. Jo has crossed busy roads without checking, approached dangerous animals without caution, entered risky situations without hesitation. She should be dead, multiple times over. She survived through luck, through coincidence, through other people intervening, not through her own danger assessment. Because she can't assess danger, her brain doesn't recognize it. The UCL team continued studying Jo. In 2023, they published follow-up research. In the journal Brain, they analyzed what else her mutation affected. They found 797 genes turned up, 348 genes turned down. Her mutation wasn't just about pain. It was systemic, affecting multiple brain pathways, multiple systems, multiple functions. Her BDNF gene was altered. This gene regulates mood, depression resistance, happiness set point. Her ACKR3 gene was changed. This gene regulates opioid receptors, natural painkiller sensitivity. Jo's mutation essentially made her perpetually happy, content, satisfied. She never felt depression, never felt deep sadness, never felt existential despair. Life's tragedies didn't devastate her. Deaths of loved ones registered intellectually, but not emotionally, not deeply. She grieved less, recovered faster, moved on easily. This bothered people. They thought she was callous, uncaring, cold, but she wasn't. She just couldn't feel negative emotions intensely. Her brain wouldn't allow it. The discovery of Jo's mutation revolutionized pain research. Pharmaceutical companies took notice. If her genes could eliminate pain naturally, maybe drugs could replicate the effect. Maybe FAAH inhibitors could treat chronic pain. Maybe FAAH-OUT activation could cure suffering. Clinical trials began, testing drugs that mimicked Jo's mutation. That turned down FAAH. That raised anandamide. Early results were promising, but incomplete. The drugs worked, but not as well as Jo's natural state. Jo is now 77 years old. She lives near Loch Ness. Still healthy, still active, still pain-free. She continues working with researchers, providing blood samples, undergoing tests, allowing her condition to be studied. She knows she's medically unique, one of 2 people on Earth with her exact mutation. The other person is her son. He inherited one of her mutations. He has reduced pain, but not complete absence. He's somewhere between normal and Jo. Still unusual, but not superhuman. Jo says she's grateful for the attention her case receives. She hopes her genetics help others, help chronic pain patients, help people suffering. She never asked for this condition, never chose it, but since she has it, she wants it to matter, to mean something, to help humanity. She volunteers for every study, every test, every analysis. Scientists are grateful. Her contribution is invaluable, irreplaceable, but Jo also acknowledges the dangers. She tells people pain is important, necessary, protective. She's been lucky, survived without it, but she wouldn't wish her condition on anyone. She's hurt herself thousands of times. Burns, cuts, injuries. She only notices by seeing damage, or smelling it, or someone else pointing it out. She checks her body daily, looking for injuries, for damage, for wounds she can't feel. This is her reality. This is her life. The medical community now understands pain differently because of Jo. Pain isn't just sensation. It's protection. It's warning. It's survival mechanism. Without it, humans are vulnerable, fragile, endangered. Jo proves this. Her life is evidence. Pain is a gift. A horrible, necessary, life-saving gift. We curse it. We hate it. We try to eliminate it. But we need it. Desperately. Constantly. Evolutionarily. Jo Cameron, the woman who feels no pain. The woman with the FAAH mutation. The woman who changed medical science. She lives without pain, without fear, without anxiety. She seems blessed, lucky, fortunate, but she's not. She's vulnerable. Every day is risk. Every activity is potential injury. Every moment is danger she can't detect. She survives through vigilance, through careful checking, through constant awareness, not through feeling. Because she can't feel. She never could. And she never will. Her story reminds us that evolution is precise. That biological systems exist for reasons. That pain, fear, anxiety aren't flaws. They're features. Essential features. Jo lives without them. She's medically fascinating, scientifically valuable, but practically vulnerable. She represents what humans would be without warning systems, without alarm bells, without the suffering that keeps us safe. She's not superhuman. She's subprotected, missing crucial defenses, living on borrowed time, surviving through luck, through careful monitoring, through the kindness of a world that warns her when she's in danger. Because her body won't. Her body can't. Her body never learned how.